I am a medical doctor, but I don't practice. I leave that to these lovely people. I talk about health and media, TV, radio, print, and online media. I have a show you might have seen in 45,000 doctors' offices across the country, as well as in Walgreens. And so I am going to introduce our first set of doctors. They come in two. Dr. Idries and Dr. Jamil, please introduce yourselves.
I am Dr. Idries. That is Dr. Jamil. We are the Twin Doctors, or TwinDoctorsTV, however you want to say it. We are both OBGYNs practicing in the northern suburbs of Chicago. Dr. Jamil, introduce yourself.
Well, I'm Dr. Jamil. Like you said, we are the Twin Doctors. Practice medicine full-time, do a little bit of media on the side. Also wrote a book that probably no one's heard of, but hopefully we'll one day.
One day.
Everything you wanted to know about pregnancy, but we're too embarrassed to ask.
And Dr. Cindy Duke?
Hi, I'm Dr. Cindy. I'm a board-certified OBGYN as well as a reproductive endocrinology and infertility specialist. I'm based in Las Vegas, Nevada. I'm also a virologist, which means I spent a significant portion of my life working with viruses and the immune system. And so I've also been doing a lot of work outside of my general clinical practice with women's health. I've also been doing a lot of work looking at COVID-19 and how it's impacting different communities around the world, including the Black community.
And Dr. Melvin?
Hi, good afternoon. How you doing?
Good.
Hi, Dr. Melvin.
Introduce yourself, please.
Oh, good afternoon. My name is Dr. Melvin Richardson. I'm a family physician with Community Health Net in Gary, Indiana.
And so we will get started with the first question. We have a lot of stuff to cover, so we want to get started right away. So, Dr. Cindy, this is for you. What do we really need to know at this time about COVID-19? Uh-oh. Okay, go ahead now.
There you go. What we need to know is that COVID-19 is caused by a virus. It's called coronavirus. And most people will become infected by the virus, but not everybody would actually develop COVID-19 disease. That said, if you develop the disease, it's very, very dangerous. You have certain people at increased risk for the virus, and that includes not just older people, but people with underlying histories of diabetes, asthma, chronic smokers. Certainly, if you're a woman planning pregnancy, you ought to take very special care to avoid COVID-19, particularly the infection. But really, what you need to know first is it's real. It's caused by a virus. It's a very contagious virus. And indeed, there are ways to try to prevent infection because currently we have no treatment and no vaccine. So the best way to protect yourself is to try to avoid becoming infected.
And so, so we can actually, the twin docs can speak to how can we avoid getting the virus.
So, like Dr. Cindy was saying, this virus is very virulent, meaning that it is very contagious, and so really it's all about avoidance. It's about avoidance. So that's why social distancing is more than just a hashtag. You need to stay away from folks because a lot of folks that have it are asymptomatic or mildly symptomatic, so they don't know that they have it. So it's all about social distancing. So although we are not practicing it right now, but I'm assuming if he's got it, I've got it, vice versa. But you want to stay at least 6 feet away from people and really further away. So that's why they're recommending everybody stay in their house. You need to maintain that social distancing. When you've got to be out and you've got to be about, then you want to provide that barrier. This is what is known as the reservoir where this virus lives is the nasopharynx. It's your mouth, it's your nose. That's why they're recommending wearing a mask. Wearing a mask prevents you from giving it to others if you have it, and it prevents it from entering into your mouth or nose if you're around people that have it. Also, wearing those gloves and not touching your face, because if it's not going to go directly to your nose or your mouth through the air, it'll be on your hands. When you touch your mouth, touch your face, touch your nose. So those are the main things you can do. Social distance. Stay away from folks. Only interact with people when it's absolutely necessary. Wear a mask, wear your gloves, and wash your hands.
Wash your hands. I was going to say that's the last thing. Wash your hands and wash them properly. They say at least 20 seconds, more if you can. Make sure you get those thumbs back, front, and yeah. Main thing is a wash.
Now, Dr. Melvin Richardson, he's going to give us some information holistically how we can protect ourselves from getting this virus.
Okay. First of all, good afternoon. And just want to thank you for allowing me to be here today. Originally, Dr. Janet Seabrook, the CEO of Community Health Net, was supposed to be here. Unfortunately, she had a family emergency, and she asked me to fill in for her. So I just want to thank you for this opportunity to be here and kind of speak on this topic. Dr. Duke actually touched on something which is extremely important about the infectious nature of this disease, and she talked about comorbidities, other medical conditions that people have that make this virus more dangerous to a certain subset of people. And when you talk holistically, I think what we do as family physicians is, unlike specialists, we consider every system, all right? So we see the patients for cardiovascular disease, heart disease. We see them for pulmonary issues, gastrointestinal issues, musculoskeletal, mental health. So we're looking at how all of this is interplaying. And I think one of the reasons why this virus has become especially hard on the African-American community is that many patients were already set up to be susceptible to a virus like this. So when you say holistically, one of the best things you can do is to make sure that the other medical conditions that you have are under control. In other words, if you have diabetes, that your A1C and your blood sugar is controlled. If you have hypertension, that your blood pressure is under control. If you have cholesterol issues, if you have gastrointestinal issues, whether it be things like inflammatory bowel disease or any other medical condition, that you make sure when a pandemic or a storm like this comes, that those medical conditions have already been addressed and are under control. Like Dr. Duke was saying, many of the admissions and the sickest people have been people who already had pre-existing medical conditions. And I know COVIDnet, which is monitoring the admissions, which is monitoring admissions of patients with COVID-19, is finding that at least 90% of all the admissions have at least one chronic medical condition. And for patients over 65, it's hypertension. For patients under 65, it's obesity. But the other medical conditions are ones that are ubiquitous, especially for the African-American community. Hypertension, diabetes, COPD, asthma. I mean, these are things as family physicians that I deal with all day long. So holistically, the way we can approach to reduce the mortality rate and reduce the complications of this virus is to ensure that we are addressing all of the other pre-existing medical conditions that are there, and then that we are monitoring to make sure that patients who do come down with this virus, that they are not losing control of the other medical conditions. So we have to not just look at the virus, we have to look at all of the other medical conditions that make the virus much more dangerous for a certain subset of people and patients.
So we do have a slide that shows the underlying conditions, but it's so many that it's kind of small. So Dr. Duke, I'm going to let you go through. Do you see the slide?
I do. I'm coming into the screen so I can read it.
Yeah, because it is tiny. But Dr. Duke spoke to some of them already. She did talk about, she said obesity. She said, what else did you said diabetes?
The thing is people of all ages. It's really important because unfortunately the initial messaging about COVID-19 suggested that only elderly folks over 65 were at risk, and that meant that a lot of people interpreted that as, I'll keep my old people at home. I can go about my life. And unfortunately, that's not true. It affects people across all age groups, including children. Fortunately, children aren't being as hard hit, but some children, especially, they have underlying medical conditions. And again, we're talking about kids who may have underlying diabetes, asthma, other lung disease, children with, problems with like sickle cell, et cetera. So you need to know what's going on in your individual household with your family members and who's considered at risk. But first and foremost, any age can be affected. The next are people with chronic lung disease or moderate to severe asthma. And now this is particularly important because some of the data that's coming out is showing that it may be a remote history of asthma, meaning you may think, you know what, I haven't had an asthma attack in years. I'm fine. But perhaps you were that child who was admitted to the hospital quite a few times when you were younger for your asthma. Then you have a history of lung disease, which means your lung biology may be very different from the average person walking around here. And so it's important to know your own medical history, and also if you're a smoker. So you may, I'm healthy. That's true. But if you're a chronic smoker, you have to know that the immune system in your lungs changes when you're, I almost choked there. When you're you have a smoking history. People who have stress, serious heart condition, absolutely. Now, guys, the big thing to know is the actual number one cause of death in COVID-19 patients is failure, cardiac arrest. And so if you have underlying heart disease, it's even more likely that your heart's not going to be able to keep up with the work that's needed to help pumping oxygen to the rest of your body. So it's very important that if you have underlying heart disease, that you really take control. Like Dr. Richardson was saying, you go ahead and you take medicines, watch your blood pressure, take your cholesterol medicine, but also wear the mask. Avoid going outside if you don't have to. Honestly, avoid going outside. And that includes church, all your family. If they don't live with you, you should not be seeing them in person for now. People who are immunocompromised, absolutely. And so there are many things that can cause compromise. Most common things can be history of HIV/AIDS. If you're on some sort of steroid chronically, so whether you have maybe sarcoidosis, whether you have underlying asthma that needs a steroid, autoimmune disease like lupus, all of these things are reasons where you may be immunocompromised without knowing it. And that's more immunocompromised that your doctor has induced to help control your condition, but it's still an immunocompromised state in that your immune system doesn't respond in the same way to an infection. And so it's important to know that. And if you have autoimmune disease, you should definitely be calling in to talk to your doctor via telemedicine to make sure you have everything that you need, including all the medicines that you need, so you can have it while you're at home. People with severe obesity, body mass index greater than 40 or higher.
40. Mm-hmm.
So 49% of our population is considered obese, overweight in the United States. That's a significant number of us. And of course, also what we should remember is obesity is tied to things like diabetes, hypertension.
Right.
A third of us actually have diabetes and prediabetes. So about 120 million Americans have either prediabetes or diabetes. And so that's impaired blood sugar breakdown and management. So again, you need to know your status and know what to do for yourself. People with diabetes, we talked about that. People with chronic kidney disease, absolutely. African Americans have very high rates of chronic disease, in part because it's related to diabetes, it's related to high blood pressure, it's related to autoimmune disease like lupus and a few other autoimmune conditions. So it's important to know your health status. And honestly, the other reason why we're asking you to take care of your health is even if you're like, I'm at home, I'm fine. We don't want your health condition to cause you to get sick, not with infection, but just get sick and land you in the hospital. Right now, if we can avoid you in the hospital for any reason, that's really helpful. And then people with liver disease, similarly. So if you have a history of chronic, if you have a history of alcohol, cirrhosis, any of those things, we would encourage you to get in touch with your doctor, even if you haven't seen them for a while, and get this addressed now and have a plan in place for what you're going to do if you think you have symptoms.
So thank you so much. So what I really want to stress is make sure people understand that's what underlying conditions are. Those are the conditions. That's what they mean when they say underlying conditions. These are diseases that you've already had that you may. I am a perfect example. My asthma has been very well controlled, but I spent a lot of time in hospital when I was a child, and so therefore I'm staying in the house. I'm just not leaving my home. My groceries are delivered to the door. I'm just not leaving my house. So you want to make certain. Go ahead.
I'm sorry, and what you're bringing up, Dr. Matthews, is also extremely important. And to follow up on what Dr. Duke was saying, unfortunately, what's happening is patients who have, and I'm seeing this in my office, patients who have these underlying medical conditions is actually causing problems with them because they are trying to avoid the hospital and they are trying to avoid their regular medical care. And unfortunately, what this is precipitating is that, people who have cardiovascular disease, who may be having a heart attack or a stroke, they have fear of going to the hospital for fear of contracting COVID. So, this is what I mean about this holistic approach, that as we put pressure, we all took chemistry. As you put pressure on one end, it forces something out on the other end. So as we begin to try to press down and push down on the number of cases of COVID, patients are ignoring other conditions, other symptoms and things like that. And they're saying, well, I want to make sure I stay at home, but at what cost? What cost if you stay home and you're going into DKA, or you're going into renal failure, or you're having a TIA, or you're having, a STEMI, or, a myocardial infarction, some sort of heart attack or something like that, because you're afraid to go to the hospital for COVID. But so this is part of what Dr. Duke was saying, and to follow up on what you're saying, Dr. Matthews, that yes, people are quarantining, but we have to make sure that we also get the message out if you need to come to the hospital. And I think Dr. Abdur Rahman can speak to this. If you're pregnant and you're going to labor, and I'm sure that you'll talk about that a little bit later. You can't say, well, I don't want to get COVID, so I'm going to stay home and deliver my own baby, and so on and so forth.
And we need to talk about that for sure, because some people are trying to do that.
I was going to say that there's actually been a little bit of a movement of patients now who are thinking of laboring and delivering at home because they want to avoid the hospital. And it's important, like you said, if you have something else going on, ideally, yes, best place for you to be is home. But if you have some other health issue going on, be it labor, delivery, diabetic ketoacidosis with the diabetes, like you said, or a heart attack or a stroke, or whatever the case may be, you need to come to a hospital. And people do need to understand that precautions are being taken to ensure their safety when they come to the hospital. I've had a few patients who've said to me, one I just delivered today actually, who asked me, are you guys taking precautions to prevent people from getting COVID? And I say, well, of course, we're at the hospital. We want to make sure we don't get COVID, and obviously we want to make sure our patients don't as well. And so precautions are taken. Patients who are diagnosed with COVID or who are what we call PUIs, people under investigation for COVID, are kept in specific portions of the hospital away from everybody else. And those who come in contact with them are kept from coming in contact with everyone else. So if you do have a health condition, you have a health concern, you do need to go to a hospital. If you don't, that's when you need to stay home.
Yeah, so you should,
if you're not,
I was going to say, telemedicine, that's what Dr. Cindy and I are both going to push. Make sure you call. There's all sorts of numbers out there. You can call and talk to a physician, and they could triage you over the phone. So that basically means that they will, quickly ask you enough questions, ask you the right questions to figure out, do you actually have an emergency? Or is this something they can call in a prescription and you can go get the medicine? And actually, a lot of the drugstores are delivering right now because of the fact that we're shelter in place. So do you need to have medicines delivered to you, or do you actually need to go to the ER? Telemedicine is essentially a house call, right? This is the house call and house visit that your grandparents were used to. The doctor can do a lot for you via telemedicine. Believe it, they can. Even if there's no video. But if there's a video, your doctor can look at you. They can look how you're breathing. They can look at your kid. They can help you a lot via video. Yeah, and there's so many things that the phone, actually, these smartphones, they have so many different things they can do. I've heard there's a pulse oximeter app. There's so many things. And this is all information that you can deliver to the doctor over the phone without having to go to the hospital.
And I think one silver lining, if there's a silver lining to this COVID pandemic, it is the fact that telemedicine is actually becoming in vogue. It used to be if you wanted telemedicine, you had to more or less pay out of pocket for the most part. But now most commercial insurances, even Medicaid and Medicare, they are covering it. So that is one silver lining. So absolutely take advantage of that.
Yes, definitely. But I mean, and to Dr. Richardson's point, if you clearly, my father had a stroke in the midst of all this craziness. He was found on the floor. He couldn't talk. He couldn't move. There was no telemedicine needed. 911 needed to be called, and the ambulance had to come. So he had to go to the hospital. So definitely, please, like we're saying telemedicine. If you can talk, you can breathe and everything, please try to use telemedicine to figure out what it is. Even if you're in labor, you think you're in labor, you should call the doctor to make certain, because if it's false labor, I know you don't want to go to the hospital and then be sent home. So just make sure you call the doctor ahead of time, have a conversation, and make sure that you can answer all their questions, and they can triage you and figure out what's going on and let you know if you do need to come in or not. So, Cindy, can you give us the most recent stats on Black people and coronavirus and COVID-19?
I just think it's really startling what we're seeing. And so, for example, if we talk first about just people who are unfortunately dying from coronavirus, we're telling people that somewhere between 1% to 2%, even 3% of people are dying. But actually, when you look at communities, first thing we're seeing is people, if they have diabetes, they're 6 times more likely to die. And mortality is somewhere between 6% and 10%, not the 1% to 3% that we've been quoting in the general media. In some cities, 6 Black people to a non-Black person dying, 6 Black dying. We know that in Chicago, it's 3 to 1, right? And so in Cook County, for example, what they've seen is that although African Americans make up about 28% of the population in Cook County, about 78%, 3/4 of the people who are dying are Black. And so it suggests that there's a lot of underlying things, and it's not just these. That unfortunately, Black people are less likely to get a test when they first present, and so there's now a lot of being done to re-educate those screening and to talk about biases that might be leading to that disparity in testing because it's unacceptable. First of all, there's more re-education going on to let people know that somebody calls saying symptoms, somebody calls saying they're having issues and you're screening up. You factor a lot of things in. We know that exposure, a lot of communities of color, Black people, they're not able to practice physical in the same way because they still need to get out and go to work. They still need to put food on the table. They're being repeatedly exposed by riding public transportation, etc. And so those are all the stats that are when you put it together, is making things so much worse in our community. And so it's important that we keep reminding each other, and also just to keep reminding people it's real. It is not a hoax, not a hoax. It's real.
So, Twin Doctors, can you please talk about, you briefly talked about it, but can you talk about pregnancy and COVID-19 and what that means for the pregnant women?
Yeah, so, we're still learning, SMFM, which is like the Society for Maternal Fetal Medicine, the high-risk OB specialists, they're releasing like bulletins almost like every other day. So, we're learning more and more every day. But pregnancy in general is a time what we call immune suppression. The immune system is somewhat suppressed because you've got this foreign being growing in your body and your body doesn't want to reject it, right? And so just in general, pregnant women are usually more susceptible to almost any illness. Now, the good news so far is that there's not necessarily seemed to be the case with COVID. It doesn't seem as though pregnant women are more prone to getting COVID, but again, this is a developing story. So in 3 months, 6 months, 12 months, I could very well see that changing as we learn more and more. But what people have to understand that when we talk about comorbid conditions, in a way, pregnancy is one of those things, because like we talked about earlier, COVID is a virus that likes your nasopharynx. It's in your nose, it's in your lungs, it's in your airways. If you think about the anatomy of pregnancy, as that uterus gets bigger and it's pressing up on the diaphragm, you have reduced lung capacity. So just that in and of itself is going to make pregnant women more prone potentially to developing COVID and to having more severe symptoms with COVID. I was actually reading a few studies. Then again, and this is a developing situation, so we don't know what's going to happen in 6 months, 12 months down the line, but there have not been any cases of what's known as vertical transmission. So the COVID infection going from mom to baby while the baby's in utero. Once the baby delivers, that's a different situation. So as far as
we don't see it in breast milk.
Say that again, I'm sorry.
We also don't see it in breast milk.
Yes, yeah, and the good thing is, and also those antibodies, because if mom is exposed, she'll make antibodies that the baby will get through the breast milk. So that will provide potentially some short-term immunity. So what we're telling all of our pregnant patients is more or less what we're telling our other patients as well. Social distancing, hand washing, masks, all of that. I will tell you, while there are no official recommendations to this effect, I have been recommending for all of my pregnant patients, if you're not absolutely essential in terms of work, just go on maternity leave early if you can, or just take the time off now while you can. So go ahead, Dr. Duke.
No, I was going to say the CDC actually recommends that any pregnant woman avoid direct contact with people who are positive or exposed for coronavirus. So if you aren't sure but you're pregnant, you can actually go to your doctor and talk about this. Your CDC has guidelines that they can write notes based on.
And I've got to say, Dr. Duke, and again, and you may know this a little bit better than I do, but my suspicion is obviously I don't think it's a mystery. We are very, very, very far behind when it comes to testing in this country. Yeah. And when you say the CDC is recommending that pregnant patients stay away from people that either have COVID or have been exposed to COVID, I think the percentage of us that have been exposed to COVID and just don't know is astronomically higher than what's being reported, which is basically
80% of people who've been exposed are asymptomatic positive. And what we don't know is whether or not they're carriers and for how long, because we know people who are very sick, some of them clear it, but what we don't know is how many people are just carriers for a long time that reactivates. And of course, it's also the reason why now a lot more labor and deliveries are testing women when they show up in labor. Yeah. And so you guys can talk to that more, but that's actually very important for a good reason.
So actually, we practice at two hospitals. So one of the hospitals that we practice at, they are moving towards universal testing. The other, we're still thinking about it. But some of some of the people we work with who are at other hospitals, yes, they are testing literally every person that comes onto that unit. symptomatic, asymptomatic, or otherwise, just because there's such this high prevalence of folks.
It is. It's also because we've seen some really sad studies that come out showing that, and reports so far for pregnant women in the United States where they showed up, they hadn't been tested, this is the earlier information, and then became quite sick during labor or shortly after delivery. And so this is the push for that, and why we're also encouraging you go to the hospital, not to a birthing center or stay at home. Because if you're positive but don't know, you can get very sick during labor or after delivery.
Absolutely, yes.
Now, what about, we've been hearing about people having to labor by themselves, and you can't have a support person. How is that here in Chicago?
In Chicago, I can't speak for all of Chicago, but all of the hospitals that I'm aware of, that's not a thing. Now, all of the hospitals we go to, they pretty much limited it to one person. So one person comes, and it's the same person the entire time. Yeah,
90%. Sorry, I didn't realize you were continuing. Go ahead, Doc. Sorry.
No, that was basically what I was going to say. I mean, they are allowing support people, but it's just one person. And we've even had cases where we have pregnant moms who are COVID positive. They still allow a support person. However, that person stays in the room, does not leave the room, cannot come, cannot go. But nobody, at least in our community, is laboring without support.
I think, unfortunately, that was a soundbite that really took off in the media, but it's not true. 90% of hospitals across the United States have not restricted spouses and doulas, because I know for a lot of people, they've been opted not to go to the hospital because they were told that they're support people. And we know there's a huge Black doula support network and movement in the United States. That really was happening in the hardest hit place in the United States, which was New York City, for good reason. And even in New York, they've now started relaxing.
Yes.
Now that they're screening everybody when they show up at the hospital. So now they can screen your doula, actually test them. They can test your spouse. But honestly, that was a soundbite that took off. It's not true. 90% of hospitals have never restricted past one or two people, which honestly, if you're in labor, you really don't need more than one or two people in the room.
Yes, I agree. So we do have a question from Jason Sims. Is it confirmed that this virus is airborne? And also, if so, how long will this last? So, yes, it is airborne.
Yeah, well, technically we call it aerosolized because it's not airborne in the sense that it can travel and travel and travel. It can survive, meaning it can remain viable or infectious in the air for up to 3 hours. We know that if there's a stream of air moving, it can go as far as 13 to 20 feet if there's a stream of air. And to really put that in perspective, if you're standing downwind from a mister, like a sprinkler on your lawn, you feel water hit you if you're downwind from that, right? It's the same thing with aerosolized droplets. When you breathe, when you talk, there are droplets coming out of your mouth. And if there's air or circulating air moving, it'll aerosolize it. So, no, it doesn't have its own wings. It's not like moving itself across the air, but it can travel if there's an airstream, absolutely.
And one thing,
one of the things the CDC has recommended. One of the things the CDC has recommended is, and then we've started using it at our own clinic because we're still in the office seeing patients, is portable HEPA air filters, air filtration systems. And to follow up on what Dr. Duke says, yes, it's a virus that can remain in the air, but it's not something that travels that way. That most of it is spread through person-to-person contact. There's some fomite contact. In other words, if you cough, you sneeze, the virus gets on some surface, whether it be a door handle or desk or something like that, and someone comes along and touches it, you can pick it up from there. But yeah, this is not something primarily like aerosol. But yeah, there are things that you do that even if you're concerned about it. And we've all got the message about surgical masks, and this is why we're doing this video presentation this way. But yeah, but they have recommended that even HEPA filtration systems can help to circulate the air and take the virus out based on the particle size of the virus, that the HEPA systems can clear the air for that. And it goes back to what we've been saying, and it's like a broken record, but it's so important. And as with the twins were saying, social distancing, staying at 6 feet away, and like Dr. Duke was saying, understanding that the 6 feet is not a panacea to completely cover. You know, like I said, it can remain in the air. So if you can start, make sure you're wearing your surgical mask. If you're in an area where you think there are people that are going to be coughing and sneezing, things like that, using portable HEPA air filters, filtration systems, and things like that. Unfortunately, most of us don't work somewhere where we have negative pressure rooms, in other words, rooms that actually pull the air out of the room and recirculate it. So we have to come up with other measures to use to reduce the risk of transmission.
Yeah, and you mentioned, if you're going to be around people who are coughing and sneezing, which is what we all worry about and look out for. But like Dr. Duke said, are they talking? Are they breathing? Because these are things that can actually aerosolize the virus, And that's why there was the American Academy of Pediatrics was weighing in on whether or not moms should breastfeed with COVID-19, and one of the concerns was, if they're not wearing a mask, if they're just breathing, potentially they could be,
Studies, absolutely. Studies have shown in just a 5-minute conversation that you expel over 5,000 viral laden droplets in just normal conversation. And, and always when I explain to my patients, I said, next time you're talking, just put a mirror up to your mouth and you'll see that you are expelling, you're having insensible fluid loss. There are droplets coming out, even though you don't perceive it, it's happening. So, so even for myself and even some of the recommendations, we when we don't do telemedicine, because I still have some patients that have significant enough medical conditions that are coming in and I'm seeing them for, we're limiting the time that we're in the room with the patient. In other words, we're focusing on those medical conditions that need to be addressed, and then, preventive sort of things. We're saying, well, if this can be delayed, I think, and I think the twins could probably speak to this, and maybe Dr. Duke, this is why hospitals are not doing elective things, because simply having someone to come in to get an elective procedure is still going to put people at exposure, even if they don't have upper respiratory or lower respiratory symptoms.
Absolutely.
We have another question. Denise Williams, Dr. Richardson, what are some recommendations you have of different kinds of vitamins that we could take at this time?
Boy, I tell you, there's, like the twins were saying, this is a very mosaic situation. And before this whole process started, before the pandemic, before COVID-19 started, there was a lot of anecdotal information about taking things like vitamins and echinacea and all those sort of things. But, the CDC has been very clear. Right now, there are no holistic or supplemental vitamins and things like that will prevent you from getting COVID and are even shortening the duration of the illness. And in fact, they actually warn against it because they suggest that it may, if it does suppress some of the symptoms, it may mask them until you have more significant symptoms. So in other words, you may feel a little bit better for a few more days, and then if you go from stage 1 to stage 2, you may have some more severe symptoms. You may have ignored the initial signs and symptoms. So unfortunately, things like vitamin C, like I said, vitamin C and echinacea. I know zinc is one that has been proposed, and in fact, studies even show that high levels of zinc can cause things like diarrhea and damage the ability to smell and taste. And I know that patients are doing this. When I go into, anecdotally, you go into the pharmacy and you'll see all the zinc and vitamin C and everything has been grabbed. And the thing is, what I always tell my patients when they ask about these sort of things is, as long as they're not interfering with what we're doing, and I can't give you a study that suggests that this is going to be harmful, then we'll look at it and say, if you want to do this, it's okay for the time being. But unfortunately, as far as from the perspective of what can you go to the pharmacy right now and purchase as far as any sort of vitamin or anything like that, unfortunately, there's not anything right now that has been proven. Now, like the twins were saying, it may not have been proven. That doesn't mean it doesn't work. Just hasn't been established that I can recommend and say we have definitive evidence that this is going to help shorten the course, make it less severe, so on and so forth. So, Go ahead. I'm sorry, Dr.
It's important to explain that it's one thing if you're asking about vitamins to just your general health and boosting your immune system. Right. But what we're really emphasizing here is if you're at home and you started feeling sore throat, you're having a cough, you've had a fever, your first step should not be to run out and try to buy some vitamins. It should be get on that phone, call your doctor, and get a plan in place and get tested, right? This is how you're going to protect yourself. It's how you're going to protect your family members. It's how you're going to protect your coworkers. And unfortunately, what's happened is, just like Dr. Richardson said, a lot of people instead have misinterpreted the supplements and vitamins information that have been circulating on social media and have been thinking it's a way to treat their symptoms. And in fact, it's actually hurt them. Some people with elderberry infections, elderberry used as a supplement, have actually landed in the hospital because it's not that the elderberry really made it worse, is that, like Dr. Richardson said, it delayed their time to the hospital. So they showed up sicker. They showed up in a worse state than maybe they necessarily needed to be. And so it's important to know that it's not that we're here telling people that vitamins don't work. They don't cure COVID. Vitamins in general are very separate from when we're talking about an infection that has no treatment. We're not being paid by pharmaceutical companies to tell you this. The truth is they don't work.
Right, and I think that's a really important point to delineate, because I myself take my echinacea, my golden pill, I take it all.
So do I.
But it's to boost the immune system. Once you have symptoms, it hasn't worked, so you need to move on to plan B.
Correct. And I think you know what? I want to say you actually articulated that perfectly, that it's to boost the immune system. But once you have symptoms, then at that point, all bets are off. Now you need to actually, and then like Dr. Duke was saying, we need to definitely reinforce this. I'm doing 50% of my visits during the day via telehealth now.
Yes.
So absolutely, once you have symptoms, and for a lot of patients, they should see this as a plus because it is more convenient. You know, if you have symptoms, you know, my hardline rule for a lot of patients is, oh no, if you need to be seen and you need an antibiotic and you need to come in, we need to do full physical exams. But now because of some of the recommendations, for example, not even to use a stethoscope on patients that you suspect have COVID-19, because the stethoscope in and of itself can be a source of transmission of infection to other people and to yourself. Now it's a little bit of a telehealth panacea, because now you can call me and if you have, just based upon your symptoms, you know, and some of the recommendations from the AFP and other places, that I will treat you just based upon your symptoms. But I think you said it perfectly, that if you develop symptoms, it clearly hasn't worked. Now it's time to call your doctor and stay in contact with your doctor too. And I think that's extremely crucial, because we are treating a lot of these patients from home just based upon symptoms. So call your doctor, stay in contact with your doctor. We want to hear from you. We want to make sure that you're okay. So don't feel like you're alone and have to run to the grocery store or the local pharmacy and pick up a lot of, vitamins and things like that. Reach out to us and get that professional information, because this is a fluid situation. It's changing, as the twins were saying. It's changing every day. Every day. I have stacks of articles behind me on my desk, because there's so much information coming out. So there's no such thing as a silly question. Don't be afraid to call your doctor and ask the question. That is important too. Stay in contact with your healthcare professional.
Absolutely.
So since people are staying home, there is a question that the Black Women's Expo audience would love to know. I think the twin doctors can address this, and then Dr. Cindy,
I know what it is. Where do you know what it is?
And Dr. Richardson said he can guess. So please tell the audience, can they have sex? I mean, there is a lot of people that are stuck at home. I mean,
absolutely,
and there's only so much Netflix and Hulu you can watch.
Yeah. I mean, so there's certainly no sexual transmission of the virus, so there's no limitation when it comes to that. Now, obviously, again, if somebody's a carrier, you're close to them, you run the risk. But the reality is, this is someone you're probably close to. You're already sequestered with them, so exposure has occurred. So yeah, there's no restriction in that regard. And quite frankly, 9 months from now, it'll be good for a fantastic baby. But I have to say, the one thing, again, Dr. Renee, now this may be a little bit of voodoo medicine, and again, we don't know what's going to happen in 6 months, 12 months, but I have been recommending that people still use protection, because this is the thing. We don't know what the effects will be if you were to become pregnant in your first trimester and have a COVID infection. Now, we don't have any reason whatsoever to believe that it will be problematic. We just don't know. And if you recall what happened with Zika, it was like 6 months, 12 months, 2 years, 3 years down the line that we started putting two together like, they had a Zika infection in the first trimester. These babies have anencephaly. Microcephaly. Well, it's various issues. So,
yes.
And so we just don't know. We don't have any reason to think that contracting coronavirus during early pregnancy will be problematic. But again, we don't know. So now it's probably not the time to get pregnant.
Now,
thank you, Twin. Thank you. That is an excellent point when you mentioned the Zika virus. That is an excellent point. I hope that whoever asked that question, whoever's listening to the conversation, the audience who's listening to the conversation, they heard that point, that we don't know what the virus ultimately can do in these situations. And this is why we're being so careful with this, because we don't know if the virus ultimately can cause some sort of damage or destruction to the baby and to the mother. All right. So consider that right now. Now is not the time to experiment.
Right. And Dr. Cindy, because you're a fertility expert, I wanted you to chime in on this too.
There are a couple of things that we do know so far. That's good news. So because I'm a fertility person as well as a virologist, I've been very, very obsessed with looking up research of, is it in sperm? Is it in semen? So far, they have not found the virus in semen, and they also haven't found it in the testicle. Yes, I know. Some guys actually agreed to that. And so they tested them, and it was negative. So that's good. However, you should know that so far, when saliva has been tested, viral particles are in saliva, and actually some of the tests that are being done right now, one of the easy antibody and viral tests that they're doing so that we can test everybody in the world is looking at sputum. And so it's in saliva. You should know that. Make of it what you will, but just know oral stuff, beware. In terms of pregnancy, they are right. The twin doctors are right. Remember, this pandemic is only about 5 months long so far, and it takes 9 months to make a baby. And so we don't really know what this specific virus does in the first trimester. We know what SARS did, though. And we know that back in the early 2000s, women infected with SARS, if they developed a really high fever or had increased risk for miscarriages. We knew this from SARS. And so we're extrapolating right now and saying that that's potentially a risk. But it hasn't been studied yet. There's also new studies that are suggesting that actually the virus is going onto the placenta and might be causing the miscarriage. We don't know yet. So like they said, caution, right? And we also don't know. What we know about COVID is if a woman is infected, just like anybody else, part of the problem with COVID is decreased oxygen. We don't know what mom's decreased oxygen may have on her baby if she were to develop COVID while pregnant, whether it's going to be developmental problems, neurological problems for baby. Only time will tell us that. So we do need, like the twin doctors were saying, a year, 2 years, 3 years to tell you those answers. We won't know yet.
So, is there any other questions? If anyone would like to, now would be a great time to type in any questions you have, and we'll try to get those answered. But Dr. Cindy, so like as we said, you are a fertility doctor. So what does this mean for your patients that are trying to get pregnant or we're in the middle of getting pregnant?
Yeah. In the fertility space right now, there's a lot of controversy, and it really stems from our governing body, which is the American Society of Reproductive Medicine. At this point, 1 month ago, put out a guideline that recommended not actively doing any fertility treatments in patients unless they were cancer patients. They've since relaxed that and said only do fertility treatments for patients for whom it's urgent. So that would be cancer patients, women who are older, like 38 and older, or low egg count. So what that means is if you're someone with infertility who has been planning fertility treatments, you're probably going to find that you can't start your treatment in most places until the American Society of Reproductive Medicine relaxes the guidelines. I'm saying most places because different clinics are interpreting the guidelines differently. So some clinics are actually still doing fertility treatments. Some are still doing IVF. I've actually resumed doing IVF, but at my clinic, we are practicing extreme physical distancing, one patient in the office at a time. Everybody's wearing a mask in my office at every time, every interaction. And so it's about checking in with your doctor. If you're a fertility patient, you can still do consultations. You can still get your sperm testing done. You can still do some blood work, but you may not be able to start your treatments for another month or two.
There's a question from the audience. Carla James, are there any differences in contracting the virus between male and female?
Well, what we're seeing is not so much differences in contracting the virus, but it seems to be the disease is worse in male patients in general. But it might also be because more men have underlying heart disease compared to women. Even though heart disease is still the #1 killer in women, more men have that. More men tend to have hypertension. So it may be a combination of things, but I would not, as a woman, decide because I'm female, I'm safe. I wouldn't do that. I would still go ahead and take every precaution here. But initial data is suggesting that men are harder hit, but we don't know exactly when this is parsed out. The truth is the United States has the most cases so far. We're going to end up with the most data. That's not really good. But on the other hand, we'll know for sure in about 6 months to 7 months, we'll get more firm data to know for sure. But it does seem that way.
Yeah, the admission rate is slightly higher for men than it is women. The rate is about 54% to 46%. But I think Dr. Dukes is probably right. That's probably a manifestation more of the underlying medical conditions that patients had prior to contracting the virus. And, you know, there's no system that's always going to be 50-50. So, even when you say, roughly 55% to 45% or so, 40, we're still saying it's roughly about 50-50. So there doesn't, right now, there doesn't seem to be a predilection towards one particular gender. But so you can't assume anything from this. So I think that's why there's not specific precautions for men versus women, unless we're talking about in cases like Dr. Duke was saying, fertility issues or pregnancy issues or anything related to pre-existing medical concerns that were occurring before the virus became so prevalent. So, but
and the same goes for blood type, right? Because I know there are a lot of stories out there circulating that say if you're a certain blood type, you're okay. That really, the statistics, they're not very different. Just like Dr. Richardson is saying about men and women, the same goes for blood type. Just because you're type O, for example, don't stay home and say you're chill. If you feel sick, call somebody, get help.
And then, actually, I think this would be a good time to address some of the myths that are out there. We have a question. Does being on a ventilator make the disease more dangerous?
It actually does. Unfortunately, the way this virus works is it damages the tissues. The virus actually attaches to cells via the angiotensin II receptor, and it actually binds to one of the beta hemoglobin molecules. And you say, well, in short, what that means is it damages red blood cells. It also damages through inflammatory process. So the lungs will get inflamed. It will produce something called cytokines, in particular something called interleukin 1, interleukin 6, and interleukin 8. And what these do is they damage a cell that produces a chemical called surfactant. And the easy way to think of this is the lungs don't become as stretchy. So in order to get oxygen into patients' lungs when they have the damage to these surfactant-producing cells, you have to use higher pressures on the ventilator. So when you use these higher pressures on the ventilator, this damages the lungs. So one of the things you're saying is, and we haven't really elucidated what this is it really damaging the lungs to have the virus, or are we actually producing some of the damage from having to use higher rates of pressures from the ventilators due to the cytokines or the increase in these chemicals like interleukin 1 and 6 and 8, which is damaging the ability of the lungs for the compliance rate. So in short, yes, the cure sometimes is as risky as the disease. And using the ventilators, there has been some damage to the lungs in using the ventilators. This is one of the reasons why one of the recommendations is that we don't put patients on ventilators unless they absolutely need to be on one, and we try to avoid that as much as possible. In fact, we don't use nebulized machines and things like that because that also as Dr. Duke said earlier, using things like nebulizer machines actually aerosolizes the virus and puts the virus into the air. So we try to use patients meter dose inhalers for respiratory conditions. We do things like try to put patients in a prone position where they're lying down. This has been shown to increase patients being able to produce secretions, to be able to clear that from, as the twins are saying, the upper airway passages and infections and things like that. So we try to avoid that as much as possible, not putting patients on the ventilator because there is an increased risk. It's a twofold. One, if you have on the ventilator, it means that your condition is deteriorated, and two, there's going to be increased risk of lung damage from breathing high pressure from the ventilator as well. So to answer your question, yes, it's very insightful.
And that's a chicken or the egg thing, because if your doctor thinks you need a ventilator, you need to be in a ventilator, because the truth is we don't have a lot of ventilators. So if they need to put you in a ventilator, it's not because they're on the fence, you need it, and they're looking to find one for you. In addition to the nebulizer, Dr. Richardson, I learned yesterday that they're also recommending, unless you absolutely have the worst case of sleep apnea, avoiding using your CPAP machine while you're positive, especially if you're at home with other family members, because that further aerosolizes the virus.
We have another question. This will be the last question.
Just to tie into what Dr. Duke was saying, this ties into the obesity issue. Yeah, this ties into the obesity because we know that patients who have obesity, a neck size above, for men of neck size above 17 inches, women 16 inches, this increases your risk for it. And so I think what's going to happen, and I can almost guarantee you that we're going to look back on this pandemic and it is going to be studied, and we're going to look at all of these, as Dr. Duke was saying, is it which came first, the chicken or the egg? Were things causative? Are they as a result of treatments? to try to determine, because, fortunately, this is the nature of this pandemic, is that there will be another one, so that we can know how to address it and be much better prepared for something like this in the future.
We have two last questions. How do you feel about the hospital offsites like McCormick? Are they safe? That's Tim Harris. So basically, Dr. Duke, this is our field hospital that they're talking about. Yeah. Dr. Richardson.
Oh, well, first and foremost, I think that this is actually a double-edged sword. I mean, because if we get to the point that we're having to use these hospital sites, that means that this has gotten really very significant. I mean, this means that we've reached capacity in hospitals, and I know that I've spoken with our health commissioner here. We've talked about what sort of capacity do we have at the hospitals, and then as the twins were saying, we have to make sure that we providers, we stay safe, because if we become sources of the virus, then of course we're going to be taken out of the equation, which is going to be more dangerous for patients. So it's a double-edged sword. To say that we're going to need to have these off-hospital sites at McCormick, it suggests that the pandemic is going to get much worse than it is now. On the other hand, because, as Dr. Duke said, there's no specific treatment per se. In other words, we don't, we don't have to have, like someone that has cancer, we don't have to be able to give them radiation, chemotherapy. We don't have to have any specific tools per se, other than making sure that we isolate the virus. That's actually a good thing. I mean, because most of the care that we're providing to patients who have this disease, fortunately, most of the patients we're providing is home care. Most of the people are getting mild symptoms, but of the patients who are truly sick, most of the care we're providing is symptomatic care. And as Dr. Duke was saying, we're trying to avoid many of the things we normally do for respiratory infections, lower respiratory infections, pneumonias, and things like that. This includes even not putting patients on excessive amount of IV fluids, because excessive fluids, as Dr. Duke was saying, can cause, a lot of these patients already have underlying cardiovascular disease. It can put patients into heart failure. So I think the take-home message is that it's a good thing because we have the ability to expand outside of the hospitals, and it's a good thing because most of these patients are just going to need supportive care. But we hope that we don't have to use these facilities, because it will suggest that, that all of us at some point are going to become internists, treating patients in the hospital, which is going to put everyone at risk.
I think just to add to that, the biggest benefit to a facility like that, though, is what we learned from looking at Wuhan, China, which is the way you control the infection, particularly at hospitals, is you move the positive patients to a different population altogether. Right. And that's where separate facilities actually may help us in the long term, because Corona and COVID aren't going away in the next 4 to 6 weeks. They're still here, and we need to be prepared for that.
So the very last question, does a 14-day quarantine really work for those with symptoms? I'll let the twin doctors take that, and then we will wrap up.
Yeah, does the 14-day quarantine help with, I'm sorry, what was the last part of that?
Does it work for those with symptoms?
So, and again, Dr. Duke may have answered this a little bit better, but so right now, when we're looking at 14 days, if you read the accounts, people have had positive coronavirus testing, their symptoms have lasted sometimes 14, 21, 28 days. So really, the rule needs to be 14 days beyond the time when your symptoms come to an end, not just 14 days.
Actually, the recommendations, so for example, at my fertility clinic, if someone's been positive, they actually have to not only have symptoms go away, they have to have 2 negative tests beyond the resolution of symptoms before they can do anything or come back to the clinic. And that's also because we're not sure, one, whether or not people are truly completely clearing the viral infection, or whether or not some of it is staying. It's still just early. It's a question of time. We'll know more in 2 to 3 months. So yes, we're telling people 14 days because really it's hard to tell someone to stay home for a whole month completely isolated from every member of their house. And so we're extrapolating actually from influenza data, which is usually we know if someone's flu symptoms are gone, within a week, they're better. But it may be different for corona. Right now, we're still going with 14 days, but it's honestly probably not enough.
Okay, so any last words? We'll start with you, Dr. Richardson, then Dr. Duke, and then the twin doc.
Stay well informed. There are numerous excellent websites. For a simple thing to remember is CDC, and then put comma COVID. And any question you have, the CDC is trying to make sure that people are educated and well informed. Johns Hopkins also has a very good website, which is actually tracking COVID and cases, not just cases, but how many cases, how many people have died, and how many people have actually resolved, don't know, are asymptomatic. Do not be afraid to reach out to your physicians. We understand that this is a scary time in your providers. This is a scary time. We want patients to be educated. As the twins have said and Dr. Duke has said, practice social isolation, social distancing. Make sure that you are covering your face when you go out. Do thorough hand washing, at least, like they said, at least 20 seconds. Take all the precautions. Err on the side of caution. If you start to develop symptoms, don't run out and try to self-medicate. Call your provider immediately. Begin self-isolation. 14 days is just a recommendation. Right? It's just a recommendation. But we all know that sometimes recommendations are just a starting point. Absolutely, if you continue to have symptoms past 14 days. We're not really sure, Dr. Duke could probably speak to this, but we're not really sure that patients can't get the virus again. We're assuming right now that they can't because they're producing IgG and IgM antibodies, but we are not absolutely certain, and this is part of even how we're looking at possibly treating the viruses by actually taking antibodies from patients who have already been infected, but there's no absolute certainty that you cannot be reinfected. So even what the twin doctors are saying, it's possible that people may be getting reinfected again. So, take the precautions for now, practice the social distancing, do the hand washing, stay in contact with your physician. If you become symptomatic, notify someone immediately.
Dr. Cindy?
Yes. Well, I concur with everything Dr. Richardson said. I really want to tell everyone we'll get through this. We're in this together, and we will get through this. And I think it's important that we all listen, believe it, feel it, because if you believe we're all in this together, then you'll understand why physical distancing, because you're protecting yourself, but you're also protecting the person out there. Because even if you don't think you can't be sure of what the other person has going on. You also don't know what other people's medical conditions are in terms of those underlying medical conditions. So each one helps one. We're in this together. It's new. This is the way viruses work. There's a lot that we don't know because it's new. It's not that medicine has failed. It's not that we, the people, have failed. There are things that could have been done better, yes, but now there's a personal responsibility that we take care of ourselves until we give science and medicine enough time to catch up and help us. This is what happened with the flu in 1918. It was new to them. They didn't have vaccines. It was just as deadly. Right now, we need to be prepared to fight this. It's not a hoax, and we will get through this together.
And how can they find you, Dr. Cindy?
And I was just going to say that. For information, yes, the CDC, Johns Hopkins School of Engineering, I've been citing that a lot. I myself have been working very hard to get timely, accurate, peer-reviewed information to people as soon as it comes. You can find me at www.drcindyduke.com. You can find me on Instagram and Twitter at Dr. Cindy M. Duke. I do very regular Facebook Lives, YouTube actually, and Twitter, talking about a lot of the things I've brought up today, talking about a lot of things as they relate to women's health, pregnancy, and just general health and psychiatric health. Because the truth is, being on lockdown takes a toll. We know this. We admit that it's not easy. I mean, I hate being at home as well, even though I'm having fun here. But honestly, just remember we're going to get through this, and each one takes care of the other and themselves.
TwinDoc?
Okay, so I think that Dr. Melvin and Dr. Cindy did a phenomenal job with the bread and butter stuff, so I'm going to get a little bit esoteric on this, but I'm just going to say I think that we need to take this and look at this as a moment in time as individuals as well as a community. Okay, we don't need to go backwards and talk about why this has been affecting African American, Black, and Brown people more than other folks. Okay, so we need to take this as a moment to put ourselves in a better position as individuals when it comes from a health standpoint for the next pandemic by controlling our weight, our obesity, our blood pressure, our diabetes, all those things. But also we need to take this as kind of a social moment. There are a lot of social reasons why our community is in the situation that it is in, from food deserts to health deserts to all kinds of deserts. And so we need to take this as a call to action also to fight as individuals, as communities, and to lobby our Congress people and to make things better for ourselves for daily living as well as when the next pandemic comes.
Right. I just to echo with the
Bill, are you gonna tell how everyone can find you?
I was going to say, since you did that, I'll go for the laugh. It's TwinDoctorsTV for everything on Twitter, Facebook, YouTube, TwinDoctorsTV. Also, don't forget our book, Everything You Ever Wanted to Know About Pregnancy, but We're Too Embarrassed to Ask. If you're here in the Chicagoland area, you can check us out monthly on Fox, the Fox News at noon with Sylvia Perez, and on Windy City Live, ABC 7.
When social distancing is over.
When social distancing is over. Until then, we're just on social media.
Yeah, just echoing what the twins said, absolutely. They talked about something that we didn't talk about that much, but absolutely, there are numerous social determinants of health that are affecting why the African American community has been impacted by this more significantly than others. And they mentioned a term that I use quite often. And someone told me once that African American communities are not food deserts; they're actually food toxic wastelands. In other words, there is food there, but it is not. The choices are not very good. But social determinants of health is what I would leave. And if we, the discussion that I would have people to have with themselves, what are the things in our communities that impact our ability to handle when things like Katrina, or HIV, or anything else hits our communities? Why are our communities more devastated by this, comparatively speaking, with other communities? And I think Dr. Duke actually brought up something extremely important. I think probably even looking at what happened with HIV in the 80s compared to now, I mean, that's a beautiful example of how science and medicine caught up with the HIV virus now. We've turned something that used to be what was considered a terminal disease. We've turned it into a chronic medical condition now where we can literally treat it with one pill and people can have normal lifespan. And so we would ask that people be patient, that modern medicine and science will catch up to this virus, and we will have a vaccine and we will have treatment for it. But until that time, take all the precautions that you can. And like the twin doctor said, be careful. This could be a virus that could cause damage to you, damage to a baby, things like that. So take all the precautions. Use condoms. Use all the social distancing that you can. Even in sexual encounters, use protection, things like that, until we know what this virus is capable of doing.
Thank you to everyone who came and joined us this evening. Thank you to the panelists. You all did a great job. That was great information. I hope you all will visit their websites and find out more information if you need it. Thank you, Black Women's Expo, for hosting this. This was a great conversation, and I hope we were able to answer some of your questions and get you guys well informed so that we can get to the other side of this. Here in Chicago, we've been hit hard, so we would like to hurry up and get this over with. So thank you so much, everyone. Have a great night.
Thank you.
Thank
Bye.
you.
Bye-bye.